Hi friends, welcome back to the channel. Are you ready today to test your knowledge about the disease diabetes mellitus? This video has 50 interesting questions and 5 seconds. Each correct answer has 1 point. Don't forget to like and subscribe to the channel. So, let's get started. The term diabetes comes from a Greek word meaning sweet urine, excessive thirst, wasting disease. Sweet urine. Diabetes mellitus indicates what level in the blood? Blood glucose, blood alcohol, blood cholesterol. Blood glucose. Who first ancient Greek physician described a condition resembling diabetes mellitus? Galen, Hippocrates, Aretaeus of Cappadocia. Aretaeus of Cappadocia. In diabetes mellitus, the body produces or has little or no insulin, resistance to insulin, both A and B. Both A and B. What is the primary hormone involved in diabetes? Insulin, glucagon, thyroxine. Insulin. Which organ in the body produces insulin? Liver, pancreas, spleen? Pancreas. What does ADA stand for? American Diabetes Association, Alliance Diabetes Association, Active Diabetes Association. American Diabetes Association. In type 1 diabetes, the body produces little insulin, no insulin, both A and B. Both A and B. Diabetes mellitus is a DASH disease. Acute, chronic, both A and B. Chronic. What is the level of blood sugar in diabetes mellitus? High level, low level, moderate level? High level. Who suggested that diabetes may be a disease of the blood? Thomas Willis, Johann Peter Frank, none of the above. Thomas Willis. How many main types are there of diabetes mellitus? 3, 2, 1. Three. In type 2 diabetes, the body has resistance to insulin, blood glucose, both A and B. Insulin. What is the function of insulin? Controls sugar level, regulates sugar level, both A and B. Both A and B. Which part of the pancreas produces the hormone insulin? Endocrine, exocrine, mesocrine. Endocrine. What cells of the pancreas produce the hormone insulin? Alpha cell, beta cell, gamma cell. Beta cell. Which type of diabetes is usually diagnosed in childhood or adolescence? Type 1, Type 2, gestational. Type 1. Who was credited to distinguish diabetes from the diabetes insipidus? Johann Peter Frank, Charles Best, James Collip. Johann Peter Frank. In what year was insulin first successfully isolated? 1910, 1921, 1930. 1921. On what date the World Diabetes Day usually held each year? 14th October, 14th November, 14th September. 14th November. What is the normal range for fasting blood sugar levels in milligram per deciliter? 70 to 100, 100 to 130, 90 to 120. 70 to 100. Which of the following is a symptom of diabetes? Excessive thirst, excessive sweating, excessive sleepiness. Excessive thirst. Which technology revolutionized the management of diabetes? Blood pressure monitor, glucose meter, stethoscope. Glucose meter. What is the most common type of diabetes? Type 1, Type 2, gestational. Type 2. Which of the following is a risk factor for type 2 diabetes? Osteoporosis, obesity, low sugar level. Obesity. Which nutrient has the most significant impact on blood sugar levels? Fat, protein, carbohydrates. Carbohydrates. What does HbA1c mean? Glucose plus Hb, galactose plus Hb, both of the above. Glucose plus Hb. What is the term used for high blood sugar levels in the body? Hyperglycemia, hypoglycemia, normoglycemia. Hyperglycemia. What is the term for excessive urination in diabetes? Polyuria, oliguria, anuria. Polyuria. Which of the following is a symptom of diabetic retinopathy? Blurred vision, loss of vision, both of the above. Both of the above. Which of the following is not a potential complication of diabetes? Kidney disease, nerve damage, weight loss. Nerve damage. Which of the following is a common symptom of hypoglycemia? Excessive thirst, blurred vision, dizziness. Dizziness. HbA1c is a type of what test? Skin test, blood test, lung test. Blood test. Which is a potential complication of diabetes affecting the gums and teeth? Periodontal disease, diabetic neuropathy, diabetic retinopathy. Periodontal disease. Which type of diabetes can occur during pregnancy? Gestational, type 1, type 2. Gestational. What is the term used for the body's inability to use insulin effectively? Insulin deficiency, insulin sensitivity, insulin resistance. Insulin resistance. Which is a potential complication of diabetes affecting the digestive system? Gastroparesis, diabetic stomach, diabetic intestine. Gastroparesis. High blood sugar levels damage what part of the eye? Iris, retina, pupil. Retina. Diabetes can only be managed with medicine. True or false? False. Which is a common complication of diabetes affecting the nerves? Diabetic neuropathy, diabetic nephropathy, diabetic retinopathy. Diabetic neuropathy. What is the term for extremely high blood sugar levels? Diabetic ketoacidosis, hypoglycemia, hyperglycemia. Diabetic ketoacidosis. How many people with diabetes have type 2 diabetes? 10%, 90%, 50%. 90%. What factors cause type 2 diabetes? Genetic, lifestyle, both A and B. Both A and B. Which type of diabetes is also called juvenile diabetes? Type 1, gestational. Type 2. Type 1. What is the most common treatment for type 1 diabetes? Insulin injections, medications, both A and B. Insulin injections. Which of the following is a symptom of diabetic ketoacidosis? Rapid breathing, slow heartbeat, low blood pressure. Rapid breathing. Excretion of what component in the urine is called glycosuria? Galactose, fructose, glucose. Glucose. Prediabetes is an early stage of diabetes. True or false? True. What is the most common treatment for type 2 diabetes? Insulin injections, medications, both A and B. Medications. Which is a complication of diabetes affecting the reproductive system in women? Polycystic ovary syndrome, gestational diabetes, premature ovarian failure. Polycystic ovary syndrome. Share your results in the comments section.